I said I work for the Community Innovators Lab, which is in the Urban Planning Department at MIT, but I spend most of my time working on an initiative called the Bronx Cooperative Development Initiative, which is I don't actually know quite what we call it in relationship to Emerald Cities, but we're the partner, but also the collaborative that is the base for Emerald Cities, New York. The Bronx Cooperative Development Initiative is about 4 years old now, and emerged out of a diverse set of Bronx stakeholders, but initially and principally community-based grassroots organizations that were deeply frustrated and tired of the sort of development process that was experienced over the last 30, 40 years in the Bronx, with all the complexities in it, but the sort of basic takeaway being that the solutions and the projects were designed largely without their consideration, their thought, their involvement, were shoved down communities' throats generally, and then those communities are sitting there living with the aftermath and the outcomes. And despite the significant levels of investment that starting in about the 90s have been going into the Bronx, the material benefit being seen by low-income and moderate-income Bronxites are quite negligible, and there's a lot of negative impacts and outcomes coming. So folks came together essentially out of deep frustration around that process, which is not dissimilar from, I imagine, stuff going around in this region, to try and come up with both a way of collaborating at a higher level and advancing some sort of longer-term vision. So one basic frame that we often think about with the Bronx, which comes from the sort of known and standard, both stereotype and some realities of the Bronx, of just the poorest urban county in the country, highest rates of asthma, obesity. You have all these great, wonderful, happy statistics about the borough that folks that are around all the time, including in Spain, where we just came back from on a learning trip in the Bronx, is known in Spain and thrown around in Spain as just, let's not become that, which is disturbing and sort of deeply troubling. So we have a frame of hopeful contradictions. Which is a basic idea of, although we have the highest rates of obesity and asthma in the state, we have the highest rates of poverty for any urban county in the country. We're amongst a rich set of assets in the borough. So we have the largest food distribution center in the world, which is responsible for 85% of the fresh food purchased in the greater New York region, just not going to the Bronx. We have some of the most preeminent anchor medical and university, Fordham University is in the Bronx, Montefiore Medical. We have the headquarters for the Wildlife Conservation Society, which runs every sort of zoo, aquarium, etc. in New York City. We have the third largest commercial corridor, and we have this ridiculous set of assets. And so the basic premise was, can we start to align some of these things and see if maybe we can make some significant progress over a short period of time. So the initiative is set up around three basic principles, which is can we build and develop a collective long-term vision for where we want the borough to go that's fundamentally rooted in building shared ownership and shared wealth amongst Bronxites? Can we establish strong coordinating and planning capacity amongst a diverse set of stakeholders? And we've been, the model we've been building out to do this, we refer to as a community enterprise network. And then the third thing is that where we collectively identify gaps, critical sort of institutional infrastructure gaps, can we come in and build some of those pieces out? So we've been starting with a local business procurement platform, and we will start to get into building a community innovation center. So amongst the sort of collaborative, it said we started with a strong lead on community organizations, but also anchor institutions are a critical part of the collaborative, as is organized labor, some finance, some progressive business, and some academic institutions, not from a purchasing standpoint, but from an intellectual standpoint. And there's a mix of anchor partners that, so hospitals, cultural, university, both public and private, and then increasing what's sort of earlier stage partnership is with the Public Housing Authority around some of our energy projects that started with data exchange and a general discussion on interest in doing community-owned energy production. And then we're effectively right now trying to get in the midst of and mess with three systems: procurement, health, and energy. Emerald Cities, where we've really partnered, is around energy. It was initially around energy and quickly moved into health and the interaction. And we see these three systems as often deeply interacting with each other. On procurement, there was an earlier conversation today that we've been doing a lot of that stuff. We've looked a lot at building this online local business procurement platform has been a major way we're starting to try and get at that. On energy, we're doing retrofit work with faith-based and increasingly multifamily, and hopefully the goal is that we will begin to move into, we are engaging in microgrid work, but we want to look at more and more into community-owned energy generation. And then on the health side, Maggie's going to talk about the specific project that we've been working at where those play together, but the sort of broader work we've been looking at with our partners and engaging with the hospitals is around the community health needs assessments and the Medicaid reform work that deeply connects to community building and community development.
Great, thank you. So again, I'm Maggie Tishman. I'm with Emerald Cities, New York, working with the Bronx Cooperative-Development Initiative. So as Nick was explaining, we have those three project areas, and I love the way you guys set it up to so clearly lay out the connection between health and energy, and the way that those interact and the role that health institutions have to play in the energy space as well. And that's really what we're trying to get at with this program, the Bronx Healthy Buildings Program. And not to harp too much on those negative statistics that Nick mentioned, but they are important. The Bronx has very poor health indicators across the board. Of New York State is ranked 62nd of 62 counties. 1 in 5 children has asthma. So it's a major issue in the community, and a lot of the asthma is caused by environmental factors. So we know that the conditions that folks are living in and are working in are both causing and exacerbating underlying conditions. So given that, and then also given that we have Montefiore Medical Center, as well as several other major hospitals in the borough, how can we bring those players together and leverage the mandate that health institutions have to heal and do no harm, and help mitigate these health issues in addition to greenhouse gas emission issues that we're facing. So this project brings together that full list of partners there. So it's Montefiore Medical Center as the major anchor partner, and the Northwest Bronx Community and Clergy Coalition as the primary grassroots organization partner that's actually leading the project. And then we come in as technical advisors on the project, and we have a whole host of other folks that are responsible for financial and legal assistance. And we're funded through Build Health Challenge over a 2-year period to implement this project that holistically tackles this major health issue of asthma in the Bronx in an upstream and data-driven way. So to give a little bit more context about the types of buildings that we're talking about in the Bronx with this project, that top photo is pretty representative of the type of housing stock in the Bronx. It's mainly low and medium rise multifamily buildings that were built in the 1940s or 50s that haven't necessarily been maintained all that well over time. So these photos at the bottom are from one of the buildings that our partners, the Northwest Bronx Community Clergy Coalition, organizes in currently. And you can see that there's peeling lead paint, which isn't directly related to asthma, but obviously isn't good for health either. There's serious mold issues in a lot of these buildings. Trash isn't necessarily maintained and taken out in a regular way, and rodents and roaches become an issue, which then exacerbates underlying asthma issues. In addition, a lot of these buildings are still burning very dirty oil that was recently outlawed in New York State and now have to switch over, but have not yet. So bringing all those folks to the table, we said, what can we do together? And we designed a program that's intended to do these 5 things. So it will reduce exposure to asthma triggers in the apartment building by remediating a lot of the issues and doing green training with supers, as well as integrated pest management to deal with a lot of the existing triggers. We'll reduce greenhouse gas emissions by doing energy retrofits to the buildings, and at the same time, the savings that you see in energy over time can be used to finance the health-related upgrades. It's a sort of innovative way to tie together those 2 aspects of the project. It'll lower residents' monthly energy bills, which is important because we know that economic insecurity also feeds into poor health outcomes. And at the same time, we're doing deep community organizing to help residents actually push these changes in their buildings. So in that way, we're building community power, we're building their sense of agency, and their understanding of the links between these issues through training around the social determinants of health. And lastly, and very germane to Emerald City's mission, we're creating jobs and wealth in the community, both through the construction and the retrofit process, and then through the hiring of community health workers, which will actually be working with asthma sufferers in the buildings to develop home-based asthma management plans. So briefly, this is how the program will work. I've highlighted the first section because that's where we are right now. But first we'll identify the target buildings, and so we're pulling together a number of different data sets in order to do that. The first and likely most important is from Montefiore Medical Center. They have agreed to share their emergency room visit and hospitalization data for asthma patients specifically, so we can see which buildings they're coming from and which are the hotspots, the really sick buildings that are driving patients to the emergency room. And then we can overlay that with buildings that have heating complaints, that have building code violations, that haven't complied with the law to switch over their heating fuel. And so that's a sort of stake that we can use to get them to participate, as well as a couple other indicators that suggest that these buildings might be ripe for this sort of intervention. Once we've identified those buildings, Northwest Bronx Community and Clergy Coalition will go in and do tenant education and organizing around the social determinants of health, but then also how to form a tenants association if there isn't one existing, and then how to pressure landlords to participate in the program if they're not. And we have legal assistance as well to help them do that more effectively. Once we have a landlord's agreement to participate and the tenants on board, we would go forth and conduct a building assessment that would identify the whole suite of upgrades that we could do, both around energy efficiency, as well as water conservation and the health-related upgrades. And so Montefiore Medical Center would in part be responsible for identifying the health-related upgrades, and Block Power, who's our finance and construction partner, would help with that as well. Then we would secure financing, move through the construction process, through which we would identify local contractors to work with and help support them in order to get the work and continue doing local hiring through the process. And we would provide necessary training to supers in the building as well as the community health workers. And then finally, once that's complete, we would do monitoring and evaluation to see how effective this actually was. So we would do a pre-post evaluation at the buildings where we intervened, and then a sort of control experimental across buildings where we did do the intervention and comparable buildings where we did not. And so just to wrap up, I wanted to highlight a little bit how the mechanics of the partnership are working, because I thought that would be particularly interesting for this group. So I've just laid out the roles of the main community partner and the anchor partner, so you can see how they're supporting one another. So the Northwest Bronx Community Clergy Coalition is leading program design and implementation, which is something that's very unique. I think a lot of the anchor-based partnerships that we've seen have been driven by the anchors rather than the organizations, and in this case it's very much the grassroots organization that's out in front, and Montefiore has agreed to be a supportive partner and to move resources to support them through implementation. So Northwest Bronx is also responsible for identifying target buildings in partnership with ourselves and other technical partners. They'll be leading the organizing and tenant education, as well as interfacing with landlords. They'll be prioritizing local hiring, so we're already running a faith-based institution retrofit program with them, so we've begun to surface some of the local contractors that can do this sort of work, and we will continue to work with them through this. And then finally, they will be conducting the monitoring and evaluation to a large degree, and the idea would be to co-publish with Montefiore Medical Center and MIT at the end of the project. Montefiore, on the other side, has agreed to supply their data, which is a huge contribution in itself because it allows us to really target where we need to with the money that we have. And they're also supplying a one-to-one match for the grant that we've already gotten through their Medicaid reform process. So they have a whole bunch of money coming down from the state in order to reform the way that Medicaid is delivered, and as part of that, they've agreed to deploy those resources in tandem with this project in order to train community health workers, to do integrated pest management, and to do some level of assessment on the buildings. And so in that same way, they're leveraging mandates that they have around expanding home-based asthma care to participate in this project, and they'll be supporting the monitoring, evaluation, and publication at the end. So I'm happy to talk more in depth about the roles of these partners or the other partners and the mechanics of the program afterwards if folks have questions.